Good morning, good afternoon, good evening, wherever you may be. Welcome to OET Medical Online. This is the first video in our speaking scenarios for the speaking part of the exam. Today we're going to look at introductions. So this is a short-ish video that looks at the very beginning of the conversation that you will have with the patient or the patient's representatives. The reason I've made this video is because several of my students have actually asked me how to begin the conversation. So I just put this together just to give you a guideline. In this video, we're going to look at a specific part of the speaking test. In both scenarios, speaking scenarios, in the test that is, the medical professional will begin the conversation each time. So you will have time to assess how you're going to begin the conversation from using your 2 to 3 minutes of reading, that should say of reading, and note-taking prior to commencing. So let's look at some situations. There are 3 basic situations for introductions. The patient or member of his or her family are known to the health professional. The patient or his or her family are unknown, so they know or they don't know each other. But you also may have a situation where the patient is known to the professional, but the family member is speaking on their behalf, and they may be unknown to the professional. So, for example, the patient might be sick or sleeping, or they can't respond for whatever reason. So the mother, parent, sibling, whoever is representing them may be speaking to you. Therefore, the introductions are either going to be formal or semi-formal. Even if a professional knows the patient, he or she still has to maintain professionalism. So obviously, even if you know someone, you've still got to keep that level of professionalism. So make it at minimum semi-formal. The setting also dictates how the conversation will begin, but it's usually one of the above. So where it is, for example, if it's in a hospital, then you'll get the unknown. If it's in a family GP, you'll get the known. If it's a home visit, it could be either. So one of these scenarios will fit our situation. So let's look at some scenarios. So the first one is a setting in a medical clinic. The patient is a 29-year-old who ate a whole fish in a restaurant 2 days ago and thinks that he or she may have a fish bone caught in his or her throat. You've examined the patient's throat and not found anything, but you think the patient may have scratched his or her esophagus as it is inflamed and swollen. Situation 2, medical clinic. Your patient is a fit, active 25-year-old. Recently, they've had trouble with their right knee, especially after running or playing sport. You suspect patellofemoral pain syndrome, kneecap pain. They've come to see you to get advice. Third one, GP surgery, private. Your patient is a 55-year-old care assistant who's injured their right elbow, while helping an overweight man out of his chair. The man fell onto him or her, and he or she is returning for the results of the x-rays. We'll come back to those in a minute. So, for the 3 situations, we have to look at keywords which could tell us what the nature of the relationship is. So, words like returning, again, back, second time, come back, a regular patient, or family GP. There are more words than this. These are just some examples. These could indicate familiarity. When I say familiarity, what I mean is that they've met each other before. We don't know the level of that familiarity, but it means they're not strangers. So words like the first time, you've been asked to, has been referred to you, and others like this indicate that this is probably the first encounter. Words like diagnosis, results, follow-up could indicate either situation. The diagnosis has been sent to you by another doctor or professional, so you could be seeing the patient for the first time, or you could have actually diagnosed the patient and told them to come back for the results. So that could be either. So you have to assess the situation, and if there's no information to indicate that they know each other, then I would take it that they don't know each other and treat it accordingly. Okay, so situation one, we're going back to situation one. Situation one indicates that there has been no prior contact. This person was eating in a restaurant a few days ago. There's nothing else to suggest prior contact, so you base things on this, the fact that they don't know each other. So possible introductions are: good morning, good afternoon, evening, whichever. My name is Dr. I will use my name, Gordon. It's Mr. Johnson, isn't it? And then the response should be, yes, it is. So that's an introduction, a fairly formal introduction. The next one is, hello, my name is Dr. Gordon. Can I check your name, please? And then the response should be sure, or yes, it is. And then the patient will give you their name. The third one is, good morning, afternoon, evening. Usually morning, afternoon. I am Dr. Gordon. What is your name and what seems to be the problem? Number 4, good morning, afternoon. My name is Dr. Gordon. I believe you have an issue with, or you have a problem with so-and-so. And then the response will be, yes, doctor, or something like that. Then you go on to the second part of the introduction. What should I call you, or how should I address you? You know, do you want me to call you Mr. Davis, or would you rather me call you Mike or Steve? So that could be part of your introduction also. All of these are similar scenarios where the doctor introduces himself or herself and checks the patient's name or asks about the patient's problem. So you can choose any of those and practice. When you're doing your practice, any of these will be fine. Situation 2 is similar to situation, but it could be that the patient is going to get advice on something from a familiar face, but the information is not given, sorry. It could be the fact that you can go to a professional for advice, which we normally do, but we also go to people we know or we trust. So it could be either, but it's not given, so we will treat it as the same as number 1. It will be they don't know each other. In situation 3, this one, the patient is returning for the results of an X-ray. Oh, I spelt that wrong. Sorry, my mistake again. That dash should be there, X-rays. So it is assumed that the medical professional ordered the X-ray and they were sent to him or her. So a less formal situation can be used here. My guess is that the doctor or the professional examined the patient and told them to come back for the results. That's what we're getting from this. So it's going to be less formal. So, hi, Mr. Johnson, Mrs. Johnson, whoever. Good to see you again. I have the results of your X-rays. Good morning, afternoon, John, Jane, Mr., Mrs., Miss. Take a seat. How are you today? And then the last one, hello, Mr. and Mr. Johnson, Mrs. Johnson, whoever. The results of your X-ray are back, and I want to inform you that everything is okay, for example. So these are, again, some more casual introductions. There are many more types of introductions, but you don't need to learn so many. You need to learn 2 or 3 for each scenario, even 2, but you've got to practice them. So these are more than enough. Okay, there's some links below that I've recorded, and you can download them and listen to them. I've tried to put some expression and tone into the introduction so you can get some idea of how you should introduce, because intonation is quite important. Friendliness, yes, directness, etc., etc. There's different ways. Don't speak with a flat tone with no emotion. You've got to put some emotion into it. Okay, so again, click on the link and download the introductions and listen to them. So that's the end of the first speaking video in the series. Please visit us for more videos coming up. If you would like tuition from us, visit our website, www.oetmedical.co.uk, which is now a secure site, or go directly to our booking site and book classes directly. For the video side of things, please subscribe, comment, like or dislike, and share this channel. The more that you share and the bigger we grow, the more videos we can produce and more time we can spend making the videos. You can also hit the notification bell to be informed when a new video is released. Okay, so thank you for your time. I hope this video is helpful to you, and see you in the next video.